Hello everyone and welcome back to our monthly update. In today's video, we'll dive into the details from December and give you a year-end review of 2024. Plus, we've got an interview with Fire Chief Kelly, and it all starts right now. In December, firefighters responded to 8,441 total incidents. Medical calls are the largest portion of our calls, but here are a few other categories we want to note. 65 structure fires, 18 food on the stove, 700 automatic alarms, 56 vehicle fires, 26 elevator emergencies, and 212 combined grass and trash fires. In December, fire investigators conducted 23 investigations. Unfortunately, one fatality occurred in a house fire, which was ruled accidental, and the cause was related to a space heater. 6 of the investigations were classified as incendiary and met the elements of arson, with 1 fire being referred to the district attorney's office for further action. 5 fires were determined to be accidental, and the causes of these fires were as follows. A house fire ignited inside a dresser drawer as an attempt was made to keep warm. A fire caused by electrical conductors due to inappropriate connections made in an attempt to illegally obtain electricity. A fire that started when clothing was placed too close to a working fireplace. A fire ignited by an electrical power strip that overheated due to a space heater, which created enough resistance to ignite nearby lightweight materials. A car fire where a person living in the vehicle used a butane torch lighter for illegal drug activity, accidentally igniting nearby fabric. In December, our transport service responded to 1,578 calls and transported 917 patients. These figures reflect the operations of 3 ambulances, and we are working towards having a 4th ambulance operational soon. Now let's head over to Fire Station 11 to hear an incredible story and highlight the importance of being trained in CPR.
Major Wiggins, Station 11 on the green shift. On the morning of November 23rd, just before 1 a.m., we responded to a call of an unconscious fainting at Northwest 43rd in Classen. We arrived on scene to find a male unconscious.
I'm Amber Shelton.
And I'm Spencer Malachy.
Yeah, I got out of bed a little before 1 a.m. Because I heard some movement downstairs, and when I asked if he was okay, I didn't hear back, so walked downstairs, and he was kind of laying on the couch, which was not normal for 1 o'clock in the morning, and asked if he was okay, and he kind of tried to stand up, and couldn't really, and kind of collapsed on the ground. At that point, I ran over to him, kind of checked to see if he was awake, shook him a little bit, didn't feel like there wasn't moving, and so I ran upstairs, grabbed my cell phone, called 911. They walked me through the process of, is he breathing? I said it was labor, so they had me count how many seconds between each breath, and it was too long, and so they directed me to lay him on his back. And I had had CPR training before when I was a public school teacher, so I kind of knew what to do, but in the moment it's a little scary. So we were able to talk me through it with the 911 dispatcher, and they had me do CPR until fire and the MSET arrived on the scene. And then once they did that, they took over from there. So we were really lucky that it all happened so quickly. We were able to call so quickly and get some help quickly.
The wife of the male was doing CPR prior to our arrival. We took over. We actually got a return of spontaneous circulation on scene, and we were able to transport that patient to Baptist Medical Center where he got more care.
I remember pieces of the night before, but really, we went and got a Christmas tree that night and, went out and did a few things. But yeah, it's kind of wild that, your brain just protects you, and I don't remember a thing, honestly, until Sunday when I woke up. Yeah, I've never had any heart issues or anything that I know of, no medications or anything, allergy meds, but that's about it.
It was extremely important that not only did she call 911 immediately, but also was able to get him into a position and administer CPR. So we usually like to make sure people understand that it wasn't necessarily the things that we did on scene that saved his life, but it was probably likely the fact that she did early CPR, at least for his brain and cognitive function.
Knowledge is power. I mean, the more you know, the more you feel like you can do in the moment. I'd say don't hesitate, call 911. They're not gonna be mad if they have to come out and you're fine, you passed out, you got a little lightheaded. That's not gonna be a big deal to them, but it will save a life, and that's so important. I have had so many people come up to me and say, wow, like, I don't know CPR. I work with elderly people. I work in crowds. I work, in an office, and I don't know CPR. And that's motivated a lot of people. I've probably had 10 people say that, they hope to get training not only for them, but for their families, for their coworkers, for their community. Though this was a terrible thing and we made it through, we're really glad that we can help others realize how important it is to have that training.
It very well could have been a different outcome. I know that the City of Oklahoma City and the Fire Department, IMSA, are teaching a hands-only CPR. So it's very minimal and non-invasive. It allows the person, if they don't know the person laying on the ground that's in cardiac arrest, all they have to do is go down and put their hands on their chest and start doing CPR. There's no swapping of bodily fluids that people are concerned about. And if she wouldn't have done that, who knows what the outcome would have been. Maybe he survived, but he had a lot less mental cognition after the fact, and it could have been a much worse scenario.
Just being grateful, just glad to be here. I had a pretty good life before, and it's even better now, but yeah, I guess the lesson is act quickly, don't hesitate. If you know something's wrong with your loved one or whoever is down, because that's a big deal. But I'm going to spread the message that CPR is huge. I get to do that in my line of work of being a personal trainer and being a health and wellness director. So I'm going to use that to help other people do the same, because this could happen to anybody apparently. So scary to think, but it's better to be prepared.
It's incredible. We were actually speaking to them about how unfrequent we get to find out what happens to our patients after we left them at the hospital with us or IMSA. So a lot of times we don't know what happened to our patients after we dropped them off, and we hope for good outcomes. But this was incredibly special to have them come by and give us some information about how he's doing and how appreciative they were of us, but also how appreciative of them we were. So it's great.
We love hearing stories like these. We want to express our thanks to Amber and Spencer for sharing their story. The crew from Fire Station 11 was invited back to Amber's workplace, where they were able to teach Amber's coworkers CPR. If you're interested in learning more about CPR, please contact the Community Risk Reduction Work Section at the Oklahoma City Fire Department. The CRR team of 9 professionals offers free educational services to improve safety and preparedness in the community. In 2024, they introduced an online request form for easier access to these programs. You can find this request form on our website at okc.gov/fire. Here's the contact information and a list of other educational programs provided by our Community Risk Reduction team. Well, that concludes our December update, but there's more. Now we'd like to share some insights we've gathered from 2024. In 2024, firefighters rescued 9 people from structure fires. Sadly, there were 5 fire fatalities, but this is a decrease from 10 fatalities in 2023. In 2024, firefighters responded to a total of 99,218 emergency calls. A special thanks to our fire dispatchers who handled each one of these emergency calls. Fortunately, with 38 fully operational fire stations spanning 621 square miles, we are well equipped to serve our residents when they do call 911. Please note these numbers do not include numbers from our transport service, as operations began halfway through 2024. 1,270 structure fires, 528 vehicle fires, 2,202 grass fires, 1,711 trash fires, 49 severe weather and natural disaster calls, over 7,000 automatic alarms, and nearly 8,100 vehicle accidents. We have 39 frontline engine companies serving OKC, and here's a list of our 10 busiest engines. The Oklahoma City Fire Department operates 13 rescue ladders across OKC, and here are our 5 busiest rescue ladder companies. Our 38 fire stations are organized into 6 fire districts, each having a command vehicle. The busiest district chief, Fire District 604, responded to 807 emergencies and is based out of Fire Station 30 near Northwest Expressway in Meridian. And an update from 2024 from our Code Compliance Office. The Code Compliance team completed a grand total of 16,080 inspections and plan reviews. And starting January 1st, 2025, apartment inspections have transitioned from every 2 years to annually. We also had 20 life safety item saves in 2024. A life safety item save is essentially a fire suppression system that went off and helped save people's lives. As an all-hazard response agency, we are proud to serve OKC by responding to all types of emergencies. Our services include technical rescue technicians, a dive unit with highly trained divers and equipment, and a hazardous materials apparatus, which houses both the necessary equipment and specialized hazardous materials technicians. Here are some key statistics from our rescue, hazmat, and dive fire stations. Rescue 6 responded to 942 calls for service. Our hazardous materials apparatus was called to 406 incidents. Our dive team responded to 55 water-related emergencies. We have 2 swift water teams stationed at Fire Station 34 and Fire Station 16. Swiftwater 34 responded to 30 emergencies, while Swiftwater 16 responded to 24. Here are a few more highlights we wanted to share. In 2024, we added a fire renovation team. A special thanks to Joe and his team for meeting the need and taking care of all our renovation and remodel needs across our department. To our shop personnel and fire mechanics, thank you for keeping the wheels on 342 vehicles maintained and running. A shout out to our fire IT and admin team as they work tirelessly behind the scenes. We added an all-terrain vehicle at Fire Station 29 to access patients in off-road areas. We have 31 new swiftwater technicians, nearly 60 new rope technicians, and 15 new divers who completed both the open water and advanced open water dive courses. The Air Tactical Unit, which is a joint team of OCPD and OKCFD, is now equipped to perform hoist rescues. The Air Tactical Unit was deployed twice to assist with wildland fires. Oklahoma Task Force 1 deployed an 8-person swiftwater team to Texas to support with flooding events. Oklahoma Task Force 1 also deployed 2 16-person swiftwater teams and also an incident management team to the East Coast in response to hurricane impact. Across Oklahoma City, firefighters and police officers are responding to calls related to behavioral health, mental health, overdoses, and drug addiction. In recent years, the Oklahoma City Fire Department launched Mobile Integrated Health Services. Their mission is to provide specialized behavioral health and medical services, easing pressure on law enforcement, ambulances, and hospitals. By offering mobile health care across Oklahoma City, it bridges gaps in behavioral health crisis response, improving access to resources and fostering safer, more resilient communities. In 2024, the Oklahoma City Fire Department expanded mobile integrated health to enhance community well-being. The program began with a community advocacy program in 2019, connecting frequent 911 callers with services including mental health care. In 2022, the overdose response team evolved into the alternative response team to assist individuals with drug addiction and behavioral health challenges. MIH also includes crisis response teams for suicidal crisis and behavioral health issues, as well as crisis call diversion, which directs calls to the appropriate response teams. These teams are currently responding to about 16 to 20 calls daily across Oklahoma City. Stay tuned as we plan to provide more information about MIH soon. Now I'm pleased to welcome Fire Chief Richard Kelly to discuss the highlights of 2024 and offer a glimpse into what lies ahead in 2025. Chief Kelly has been with the Oklahoma City Fire Department since 1991 and has served as Fire Chief since his appointment in September 2017. Chief, I really appreciate your time. I know you're busy. Thanks for sitting down with us. Really just want to sit down with you and visit 2024 numbers, maybe 2025 numbers looking ahead. So really just looking back, 2024, as far as incident response for us, it's record number again, over 99,000 calls, just shy of 100,000. So give me kind of your thoughts on that. You know, each year we're progressively getting busier. Just what are your thoughts as far as our city growth, fire department growth, as the numbers increase for our firefighters?
Well, first and foremost, I just want to thank our firefighters and what they do every day. I know so many times we get caught up in the milestones and the data, which is extremely important to show the great work that they do every year, but really just want to thank them for their great work. We've been there understanding that they're away from their families. They're doing this 24 hours at a time. Just want to thank them for the great work. But, when you talk about numbers, it is something that we're seeing a definite increase. I remember when I first made chief, it seemed like we were pretty consistently about 75,000 a year, and then we've seen, over the last 4 to 5 years, a significant increase every year. So obviously, with the growth of the city, what we're seeing is, more people, the trusting and calling 911, and the utilization of the services that we're definitely seeing an increase. So it puts a stress on our organization, puts a stress on the city. Any type of public safety, fire, police, EMS, definitely seeing challenges. So it just brings to focus the great work they do, but also for us as leaders to try to identify ways, how can we, reduce the calls, how can we do community risk reduction to try to keep our personnel from having to go out of the fire station and respond on these incidents.
So Chief, looking back 2024, what would you say some key achievements for our department was?
A lot of great things, again, that's taken place, but there are things that come to the forefront that I'm really proud of. I'm really proud of our new mobile integrated healthcare program. Super excited of developing crisis response teams, alternative response teams to mental health situations. I really am excited the city supported that. It's a co-response with the police department to be able to put professionals that are trained in behavioral health services along with paramedics that have experience and are very good at taking care of, of our residents and our people we're responding on. I'm really excited to see that come to fruition, just because I feel like as a fire department, we've always been focused on our community. And this is another way to step in that gap, to be able to put the appropriate resources on these incidents, to respond to behavioral health calls, get on scene and take care of the situation and provide the appropriate resources. I'm super proud of that program. In our mobile integrated healthcare, we're also seeing a crisis call diversion program. We're in the beginning phases of that we started this year, but obviously we'll see it come to full fruition next year. But really looking forward to that. We've done some training, and that's where we'll have a behavioral health specialist in the 911 center. So super excited about that. Really proud of our transition from our CAP program that we had in EMS training for years. Lieutenant Billy Downs really took that to new levels, working with our field personnel to address those high volume utilizers and being able to connect people to services and get the appropriate resources for those in our community that are going through a challenging time. But I'm really excited to see now that we've moved that under our mobile integrated healthcare with Lori Brown Loftus as the program manager and putting behavioral health specialists in that CAP program of really taking that to the next level. So really excited of seeing that program really start to blossom. The other part is, in the history of our fire department, 135 years of tradition, super proud of what we do every day, but we rolled out the first EMS transport unit this year. Obviously, it's a supplement to work with IMSA as our primary provider, but to see that really come to fruition, to see the great people we've been able to hire, the excitement there, to be able to continue to provide high-level services in our EMS system, that's something that I've always been excited about, and to be able to see that come to full circle, that's another thing that I'm really proud of. Kind of ties in this area. We've been focused, patient-focused, patient-centered fire department for years, but we rolled out our whole blood program. Wasn't this year that we rolled out the program, but what we did see this year is we actually administered our 100 unit in the field. Between fire and IMSA and collaborative services, to be able to see that come in to our services to make a difference. It saves lives. It's been proved it saved lives. To see that happen, we partner with OU on that, OBI, Oklahoma Blood Institute. Now we're working with Baptist Hospital to be able to start seeing that. The OU Trauma Center was the catalyst that carried us forward in that area, the Office of the Medical Director. You see all those teams that had to be in place to make that come to fruition and see that serving our community. Super proud of that, 100th administration of that. Another area, we're always focused on our people, and we've recognized for years that our firefighters are dealing with exposure to chemicals and different things and structure fires. And this year we started our clean gear process where we actually, on a scene, where we come out to these structure fires and we can actually trade out and put our firefighters in a clean set of gear and now be able to take their gear back, wash it, inspect it, do that, and then bring it back to the station a couple days while they're in clean loaner gear. I'm really excited for that. I think it reduces the exposure challenges that we're faced with our firefighters. And, and we're going to move into other areas in 2025 to help us look at how we can continue to serve our firefighters and make sure they're healthy and be able to perform at a high level.
What would you say some of the challenges 2024 that you saw? I know, like you said, we've introduced the whole blood, we've introduced the transport service, the trading out the gear on scene, but what was something that was really a challenge not only for you, for our department, across our department?
I think one of the areas, and you started off this conversation with that, is the call volume. When I look at every year, I look at the numbers, and we usually do ours through a physical year. But when I looked at last physical year, from June 30th up to July 1st of this year, July 1st to June 30th of this year, we had 8 engine companies that were over 4,000 calls. And then we had one that was almost at 5,000. So that's a significant call increase in the challenges it puts on our firefighters. The ability for them to train every day. We were required to do 2 hours of training every day, hour and a half of physical fitness, all on top of serving our community. And that's to make sure that we're well-trained and physically fit and be able to do a job. So that call volume is something that creates significant challenges. On top of that, we talked about our reduction of exposure to chemicals. One area that we're really starting to see a lot of challenges is our sleep deprivation of our firefighters. On a 24-hour shift, you have numerous fire stations that do not get full sleep overnight. Many of them, sometimes 3 and 4 or 5 calls a night. And that's a challenge. And when you mess up that circadian rhythm, if they can't get that back on their days off, we're starting to see challenges in that area where it's actually we're seeing some of the tests and some of the studies that they're doing, that may be a greater challenge to our firefighters in their challenges of contracting cancer. And so that's something that really is extremely challenging, the call volume that puts a lot of stress on our firefighters every day. And, with that, it seems like in emergency services, public safety in general, we're seeing more and more demands, more and more things that we're involved with. We're in public health, and we talk about, the mobile integrated health care, but we get involved in those areas, and we're, community risk reduction, making sure people have a working smoke alarm. We're doing a lot of public safety talks on top of the increased call volume. So we're seeing continuous challenges there that makes it really tough for our firefighters. On top of the call volume, what we see is now increased call volume. We're seeing more and more of our firefighters to exposed to what we call potentially traumatic events. And that's where you have a significant event where someone's, injured pretty severely, or we have some of those situations that create a lot of emotional trauma within our firefighters. So with that increased call volume, you have the higher propensity for our firefighters to be exposed to that. So we're really making sure we're staying on top of our behavioral health services with our peer support program that we have in place, really trying to focus in those areas, but that definitely is creating some challenges for our firefighters.
So that really leads into my next question, Chief, talking about how busy our fire department is, physically taxing, mentally taxing, what we see. How would you say, how are you combating that as the fire chief, as our department? I mean, obviously you see the need there. What's our department doing as far as the physical and mental wellness of our firefighters? Really, what I want to start off with is, the culture of our fire department. I'm super honored to be involved as the fire chief, but we all know it's not one person, it's all of us collectively. And what we've all learned over the years here, it seems like as our organization, our culture has always been to seek training opportunities, to learn, to
go to other fire departments and see what they're doing. Look at other professional organizations outside of ours and see how we can improve what we're doing. And I think through that, you're seeing some programs that we've been able to put in place that really is just listening and learning and seeing what's there. And one of those is our behavior health program. Obviously, we have a peer support program. We've always had a very robust CISM program, critical incident stress management program. But it really is coming full circle with the hiring of Sarah, who is our licensed clinical social worker, who that's her area of expertise. She's a counselor by training. She understands, people that are dealing with trauma, and she's all in. And that's something that is just the beginning, I believe, of how we continue this culture and how we improve services to our firefighters, because we really look at it, our focus, we're here for service and services to the community, but if we can't serve ourselves and we're not in a good space and we're not healthy, and that means mind, body, and spirit, we can't go out and respond and take care of people at the highest level. So, putting Sarah in place, she's done so many things to help us improve, and she's learning every day, and she's always challenged herself to look at other options of how we improve. But she's put out a behavior health toolkit. We're looking at areas that she can be involved with every day, of meeting with our member for services, of providing training to our peer support team, offering those type of in-depth experiences that she has drawing from her training, and obviously what she's learning every day. So really excited on that side of the behavior health. And we've got some other areas that we're rolling out and working into and trying to develop. And then kind of going to that whole body, that whole person experience of making sure the whole health. We have Damon Glass, who we've hired as our athletic trainer, and Damon comes to us with a wealth of knowledge, 25 years plus as an athletic trainer, working for a doctor, and a surgeon, an orthopedic surgeon, has experience in those areas. And we really look at our firefighters, they're industrial athletes. They have to go from 0 to 100 performing at the highest level, peak performance that they can, and that really takes a toll on the body. So really having Damon there, we've seen that pay dividends as he went with our recruit class that just graduated with him every day to make sure just the basic stuff that we see athletes do, professional athletes, taping and supporting and making sure that we're not injured, but we can go back to work. And, we're going to get, those nits and those nicks that we have that, maybe sideline us just a little bit to make sure that we don't have a full injury, but get them right back into play and we're good to go. And then obviously on top of that is how do we make sure that we rehab an injury in the appropriate way so we get someone back to work quickly and not overdo that. So many things that we're looking at there. And then we forget what we've had. We're fortunate we have a chaplain that is on that spiritual side. I know that's not for everybody, but it's important when you look at mind, body, and spirit that we have that. And I feel that we have the trifecta there. Now that's the foundational process. We need to continue to build on that to improve what we're doing.
So looking forward, really just the world we're living in, just advanced with technology and equipment. How has that impacted the fire service, and is there any new tools? I know we're replacing rigs as they need to year after year, but any new technological advancements or equipment with the fire department?
I'm really proud of what we've been able to accomplish in the technology market. It's probably our firefighters out there, this area that probably hits them pretty hard. I mean, probably thinking every other week we have something new or rolling out. And I appreciate that they're willing to dive in those areas, and sometimes through frustration, but the reality of learning these processes. But we're constantly looking at that. And one of the areas that we're seeing that is paying huge dividends in a short period of time is Good Sam. And Good Sam is an app that we have in our 911 that is set up for our fire dispatchers, that someone calls 911 on a cellular line, that we can actually send them a link, and when they click on that link, we have access to their phone and they can show us exactly what they're seeing. Again, many times the information we're getting is from a lay person that doesn't, they're just not trained in that area, and so they don't have the experience to know what we're looking at. And when you have that now, you can get real-time information. We actually get that video feed. We can forward that to our chief officers that are responding to these incidents. And we're seeing a tremendous amount of information that's coming to our firefighters. So we're making informed decisions en route and prepared to show up and provide the highest level of service to our community. And I think that's just a small area. That app has so much more potential, but we're seeing in that is embracing that technology to utilize that to serve our firefighters, because the more informed they are, the higher level they can perform at, because they're walk into it knowing what they're dealing with, and then our residents, making sure that we're there, showing up, being able to deal with our emergency in a timely manner. We get there and know exactly how to, to provide the best tactic for that. So Good Sam is a perfect example of that. Also, we've rolled out our DFR program, drone as a first responder. Now it's going to take several years to roll that out, but really excited to see that we'll have full service as a drone capability, the UAV, unmanned aerial vehicle, that will have that capability here in the metro to be able to get a drone launched to those scenes to get information. Again, we're talking about information feedback that allows us to, number one, send the appropriate resources, and number two, to get information so when we show up, we can go right to work and be able to provide the highest level service. So super excited for those two programs right there that we're really seeing that I think is going to make a huge difference. Another area for us that really it affects our firefighters, and I know there's a challenge for them as we change and we move, but we've done a lot of work in our data platforms to be able to collect all of our data to one location, and we're able to house that on an intranet site that we call our Fire SPO, and that's just SharePoint Online. That it's a resource, so our firefighters now can go to one hub location and get information, log into different platforms that we have. But on top of that, it gives them real-time feedback of what they're doing, the activity levels, what they're working on. They have a lot. What people don't realize is firefighting has a lot of technology in it. Our firefighters go to a scene, but when they come back, they have to spend a lot of time documenting, making sure things are working. When they show up in the mornings, they check all their apparatus, all their SCBAs. There's a lot of things that they do to make sure the safety equipment obviously is working at a high level. So when they show up, they know they can go to work. They're not worried about their equipment. But we document everything there. And to have that one location to try to simplify that for our firefighters is our long-term goal. We want to make those processes easier for our firefighters so they can focus on the big stuff: training, preparing, pre-planning, showing up every day, ready to go to work in that area. So those technology platforms, I believe in the future, are going to be huge for us to really allow us to focus on what's the important part, and that's the service to our community and what we're doing.
So moving ahead, 2024 is behind us, looking ahead at 2025, what are some of the top priorities that you're looking at through this year? So, we're on trend. Each year we've responded to more and more calls. So what's something on the forefront of your mind as we move forward to 2025?
Well, really, when you look at our services, a lot of what we do is we have to look at our capital projects, and a lot of that is fire stations and making sure that we have appropriate resources and that expanding resources and what we're trying to accomplish. Some of the things that I'm really excited about this year, we're really starting to see some of our major projects start to gain a lot of ground. So we're rebuilding Fire Station 31, which is a 3-bay fire station, to a 5-bay fire station to allow us to have more equipment there, to house our firefighters in a new facility so they can perform at the highest level when they go out the door. We also have 2 other fire stations we're rebuilding that's part of the bond, and that's Fire Station 10 and Fire Station 13. Fire Station 10 is off 16th and Penn downtown. Then Fire Station 13 currently sets off 74th and Air Depot in the southeast part of the city. Again, rebuilds in those areas. Fire Station 13 is going from a 2-bay to a 5-bay fire station. We'll house one of our district chiefs. We'll move a ladder company out there. So really excited for those increased services in that area. And then Fire Station 10, we're working on that to rebuild that fire station. And then we have what's really big for public safety is a public safety training center that we've already started on our driving track, which will have a driving track for law enforcement, for fire in that area, a big skid pad to do training. You know, when we're driving down the road in, 40,000 pound engine companies and 80,000 pound ladders, we want to make sure our personnel are trained to the highest level. So it's a great opportunity to move in that direction for these capital projects. So, and then we look forward to the future and what we can serve our community and continue to build in that area. Really, and I think of this when what we want to do in 2025 is focus on 3 different areas. Focus on our people. So we want to continue the services that we're doing. We want to expand what we're doing in our wellness programs. And that is important because every year our firefighters get a physical. And we do that to make sure they're healthy, to make sure that they're ready to respond. And so we're really looking at expanding those services that we're doing there and providing a higher level in that. And then we want to focus on our challenges. And what I mean by that is, as a leadership team on our fire department, our job is to really look at the challenges that we have and how do we improve that. But what I'm excited, I think we really need to get the organization thinking about that. And they do every day, but sometimes they look at that's not my lane. And so we've started a new lead program that's a leadership program that will have all ranks in this. And their job and what they'll do is obviously some leadership training and knowledge and experience in that area. And then they're going to focus on the challenges. What are things in our department we need to improve and need to make better? And sometimes you get that ground up and that groundswell of people looking at that. I'm super excited for this program. It won't affect the entire department, but I think it's a great way to allow people to lean in at all levels within our organization, all ranks, and be able to say, here's a challenge, here's a fix. And I think that's going to be empowering. And I'm super excited for that. The other area is focus on our service. And that in focus our service is how do we respond at a higher level? How do we train our people? How do we look at knowledge, skills, and abilities? How do we increase our education? And that's the part we're always going to look at. And I use this term R&D, and sometimes that's going out and looking what people have, and that's where we rip off and duplicate it. And that's where we actually see there's a lot of great resources out there to see great things that are happening in different communities, and we take it and say, how can we take that and bottle that up and improve what we're doing here? And that's what I want to do for 2025 is challenge us all to go out, look at what we're doing. Are we doing it the best way? Is there a better way to do it? And how can we improve our processes? And we want to do that as the leadership of the organization, but also empower people to do that, to try to find the best way to serve our community. And I think if we're all doing that our organization will continue to grow, will continue to improve. I know sometimes people are challenged and concerned about making changes within the organization. It feels like we're always in a change cycle. I think we have to manage that and talk through those things and look at why are we doing these things. I don't ever want to change just to change. But I do want to focus on, are we doing it the best way and can we make improvements? And I think that 2025, you're going to see great things out of the Oklahoma City Fire Department. We have great people here to serve, dedicated to the department, dedicated to do excellent things. And I think 2025 is going to be a great year for our organization.
Chief, I just want to say thanks for joining us here in the studio and appreciate your support. Last year we launched the studio. We've been able to do a lot of good and hopefully to inform our residents everything the Oklahoma City Fire Department is doing. So wish nothing but the best for you and your family in 2025 and to our residents, and appreciate all the work you do for our department. So thanks, Chief.
You bet. You guys are doing outstanding work. Thank you for what you're doing.
Well, thank you for joining us for this update. If there's any information you'd like for us to include in future updates, please let us know in the comments below. We'll do our best to add it in upcoming videos. Wishing you a safe and wonderful 2025, and remember, OKC, we're here if you need us.